Hi, it's me, Andy B, the Dizzy Busy PT, speaking out for all of those who are too busy to be dizzy, where our goal is to transform your vertigo to vertigon. All right, I know, enough of the crazy puns and rhymes. Let's get to what really matters. Today, we're going to talk about what does vertigo mean? You've gone to the emergency department, you've been to your doctor, you've been tested, and you were told what's wrong with you, right? Maybe not. You've been told you have vertigo. Does that answer the question of what's wrong with you? Well, maybe. Here's what I've learned. I've been practicing treating people with dizziness and balance disorders aggressively since the year 2000. And I've had many patients who come to me with the diagnosis of vertigo. Well, what exactly does that mean? In the world of healthcare providers who study dizziness and vertigo, vertigo just is a symptom. Vertigo means spinning. So if you go to the doctor's office or you go to the emergency department and you're told you have vertigo, what that really means is that you have a spinning problem. But that doesn't tell us why you're spinning. Now, let's get practical and real world. If you go to the emergency department because you're dizzy and you don't know why, what do you think the people in the emergency department really care about? Well, they want to make sure you're not dying. They want to make sure you don't have a heart attack, you don't have a brain tumor, you aren't having a stroke, you're not having any type of weird metabolic problems, electrolyte disorders, blood disorders, some type of issue that could be life-threatening. So some emergency department doctors are a little extra and they know how to tell maybe what else could be wrong, but to be honest, their hands are full. They are working with a lot of crazy cases of vast diversity, and the amount of things that they have to know is beyond belief. So most of the time, you're going to go to the emergency department, you're dizzy, and they're going to find out whether or not you have something serious. If you don't have anything serious, and they're pretty sure that, well, it's probably a benign issue, you're probably going to be given the diagnosis of vertigo. So in my world, when I look at my patients who've been given that diagnosis by their medical doctors, by their family practice physicians, nurse practitioners, physician's assistants, they go to the emergency department, they're given that diagnosis. That usually means to me that, well, the doctor doesn't think there's something serious wrong. But then what could be wrong? Well, if a person has true vertigo, that means they're spinning. And that means that most likely there is a problem with their vestibular system. Now, vestibular system has two major parts, but let's back up. Why is it called the vestibular system? The vestibular system is the vestibule, or the entryway to the brain. You know something fascinating? The first sensory input to our brain in utero, it's not the eyes, it's not the sensors in your hands or feet, it's the inner ear. When your head moves, the inner ear sends messages to your brain. It's the first sensory awareness, the first sensory input that your brain gets when you are in utero. It's crazy. So that's why this system is given the name the vestibular system. Now, there are two main parts to the vestibular system, and hang on with me, I'm going to explain what this has to do with vertigo here in a second. There are two main parts to the vestibular system, the peripheral part and the central part. So as dizzy experts, when we're trying to figure out why you have vertigo, we're trying to know, is there a peripheral problem and or a central problem? If there's a peripheral problem, that means it's a problem in your inner ear. The semicircular canals, the tubes, the calcium crystals, the nerve, just a few things inside the inner ear that we really look hard at. okay? If it's a brain problem, if it's a central problem, that means there's an issue with the brainstem or the cerebellum. Migraine, for instance, can cause a brain issue because it is a brain issue, but believe it or not, you could have a vestibular migraine that also causes inner ear issues. Similar to optic migraines, or you might have heard of silent migraines, where you get these little bubbles in your vision and that lasts for about 20 minutes. Sometimes you lose vision, you see sparks, flashing lights, you lose vision, and then about 10 minutes after the vision comes back, sometimes you're hit with a pretty intense headache, and if you're lucky, maybe you don't get much of a headache. Well, that kind of migraine attacks the eye system. You can have a vestibular migraine that attacks the vestibular system, causing spinning and different variants of spinning. So, back to the main point. What does vertigo mean? You're given the diagnosis of vertigo. What that really means is that it's probably been ruled out that there most likely is nothing serious going on, and we think you might have a problem with either your peripheral vestibular problem or your central vestibular system. And so what we do in therapy is we look and we try to figure out, why do you have vertigo in the first place? The yucky stuff has been ruled out, the scary stuff has been ruled out. Now let's find out why you have vertigo. Some of the most common reasons for vertigo are benign paroxysmal positional vertigo, vestibular migraines, vestibular neuritis, labyrinthitis. Okay, so those are very common reasons. And we break vertigo down into triggers and timing. But we'll get to that in another video. The main point today is that I want you to understand vertigo is a symptom. It's really not a diagnosis, even though it is very commonly given as a diagnosis, and understandably so. So after listening to this video today, I hope you have a better understanding that the diagnosis of vertigo means spinning, and it can have a peripheral cause or an inner ear cause and a central cause or a brain cause. Stay tuned. Next week, we are going to talk about one of the most important tests on how to know why you have vertigo. And believe it or not, the test is not thousands of dollars to perform. It can be done very easily with something that you may already have in your power. So join me next week to learn one of the most important vestibular tests that you can do to figure out why you have vertigo. If you enjoyed this video, I ask that you hit that like button, subscribe to my channel, and I really want to know, have you been diagnosed with vertigo? If you have been diagnosed with vertigo, how did they figure out what was wrong with you? Have they figured out what's wrong with you? Are you kind of battling a kind of dizziness that nobody has explained why it's present? Where are you at in your dizzy journey? Let's create a little community here of people who can talk and share, and I'll be happy to work with you all and help guide you through that program. What we want you to do here is learn and grow and be as dizzy free as possible so that you can go and spin no more. Thank you.